And I'm sorry the line was so long, but we had a great turnout. So during lunch, I wanted to give you all updates on a couple of national projects that are going on, national efforts, to really bring a focus to lymphedema and change some of the pictures that the state of what we know about lymphedema and access to care that we've been talking about. So our first speaker is Dr. Jane Armour, and in addition to being the director of the American Lymphedema Framework Project, which she's going to explain to you, she is professor at the Sinclair School of Nursing and director of nursing research at Ellis Fishel Cancer Center, and she really has built a stellar research career in the area of prevalence, signs, symptoms, fatigue, self-management, etc., and has currently two R01s, two big grants from the National Institutes of Health to look at lymphedema incidence as well as start looking at genetics. So it's my pleasure to have Jane now present on the American Lymphedema Framework.
Thank you. Thank you, Electra. Thank you very much, Electra. It's really a privilege to be here, and we are so thankful that Ohio State University has hosted this summit for us to bring us together and look at the current issues in lymphedema and look at our way forward. The fortunate thing about your packet and our time frame is that you have a handout that I'm going to work through fairly rapidly in about 10 minutes. You have a handout about the American Lymphedema Framework, and I'm going to highlight some of our background and our successes and our next goals. So I'm going to move through that handout, but not use every slide that you'll see, but it'll be there as a reference for you. I want to say that we're privileged to have the Executive Committee of the American Lymphedema Framework Project here, and that includes Dr. Joe Feldman, Dr. Janice Cormier, and myself, and we have several members of our steering committee. I don't want to miss anyone, but I'm going to point out Julia Roderick, Marcia Beck. They can hold up their hands. Kathy Tuppo, Kathy, Dr. Bob Stewart, Bob Weiss, Kim Andrews. Kim, I don't know just where you are right now, from the American Cancer Society. So we've come from, I think I've met Mike Burness. Mike isn't in the room right now. And Electra, I'm sorry, Electra, I was looking around there, I'm sorry, Electra. Yes, I was going to show us that we're from all over the country and centered right here in the Midwest. With Electra being on our steering committee, we've got two members from Illinois, three members from Missouri, actually, that are here, and then Texas, Arizona, California, and New York represented. So we are widespread and we're multidisciplinary in terms of being OT, PT, massage therapists, physicians, nurses, and advocates for lymphedema. We are a national framework invited to be formed by the International Lymphedema Framework from the United Kingdom. And with that, we've taken leadership in moving the field forward for lymphedema patients and for health professionals, for industry in the country, to improve care for patients with lymphedema and lymphatic disorders and those at risk of lymphedema and lymphatic disorders. So we're a collaboration of healthcare providers, researchers, patients, educators, advocates, industry, and partners with the International Lymphedema Framework. Our mission statement is on this slide. It's on our website at ALFP.org. So I won't read this to you, but I'll say that it's there for you. Our structure is also at the website that shows the structure of the Executive Committee, the International Advisory Committee, the Industry Consortium, our steering committee and our stakeholders, and then our committee structure. So if you'd like to get involved with the ALFP or know more about us, there's more information about us at ALFP.org, the website. Here we have the 6 goals that we set when we formed in 2008. They're listed as a result of the stakeholders meeting that we held in Chicago in the spring of 2009. And I've highlighted 2 of the goals that we have prioritized and that we'll be reporting on you today. I'm going to briefly review the systematic review process that we've had and our manuscripts that have been published from that. And this afternoon, Dr. Bob Stewart is going to report on the minimum data set. So you'll hear about these 2 goals today. We had a strategic planning meeting last night. We'll be reviewing and revising the goals as we go ahead based on where we started in 2008 and where we are today. We have 3 publications in Journal of Lymphedema, a journal out of the United Kingdom. The first one that you see on your left is a report of the stakeholders meeting in Chicago. So if you're interested in what we learned there and how we set the goals, that article will give you some background. The second is the result of a survey of lymphedema therapists in 2009. We repeated that survey in 2011, and we'll be reporting those results at the NLN conference as a poster. And it will soon come into a publication as well. So there's more information if you have interest in that. And the third is a manuscript that we published in describing the process for updating the best practice document from 2006 that was initiated by the International Lymphedema Framework, and that several of us participated in a consensus process to support that document. So it reports on our systematic review process, and today I'm going to give you outcomes from that. The process itself is in this manuscript, but not the results of the process. So again, I'm going to touch on the systematic review in this 10 minutes or so. There's an article that describes the process. There's a timeline that shows in the last decade the different systematic reviews related to lymphedema that have been carried out. If you have interest, the authors are at the bottom of this timeline in small print on your handout. I'll point out that in 2006 was when the International Lymphedema Framework's best practice document was published, with the completion of review of literature through 2004. So that caused us to begin our literature search at 2004 and to go forward through 2009 and 2010 with our systematic reviews. This is a picture of the best practice document. Many of you may have it. It's being used by therapists to guide practice in many ways in this country and in other countries of the world. Our goal was to help to update that document and to produce a series of manuscripts reporting the topics as we reviewed them in the updated literature. This is a timeline of the systematic review process, and the next 5 slides or so actually detail the steps of the process. I'm not going to spend very many minutes on that because I want to get to the results, but in summary, we hired the services of a professional reference librarian at the University of Missouri to do an extensive literature search over a 6-month period from the literature from 2004 through 2009. We continue to update that literature through 2010. We sorted in a series of review processes almost 6,000 articles that had lymphedema in some way in their content. Some of those were immediately known to not be valuable for producing evidence for our practice, so they were set aside. Those that were promising, we handled ourselves, Dr. Cormier, Dr. Stewart, and myself. We handled those to sort those to confirm that they were valuable to documenting the evidence for our practice, and we sorted them into topical categories. Then the topical categories were taken by a very dedicated team of clinicians and researchers for applying a weight of the evidence in those articles through an appropriate system for that set of literature. And from that, the authors have proceeded to publish systematic reviews on those topics to be placed in the pertinent refereed literature. And that's the process we're in right now in 2011 and 2012. By the close of 2012 or early 2013, the process should be concluded, and then we'll be making a decision about how we keep those updated for the future. So a series of meetings took place face-to-face and certainly electronically and by conference calls to establish the team of people working on the systematic reviews. We tend to meet at naturally occurring events like at the NLN meetings, ISL meetings, ILF meetings, and for instance, last night as we came together for the summit, we met for a strategic planning meeting. This is a timeline that shows that search process, and I'll draw your attention to the white box at the bottom that shows the databases that were searched by the reference librarian. So we went to the ones that would be most commonly considered, like PubMed or CINAHL for the nursing and allied health literature, Cancer Lit, and the Cochrane reviews, but we also went to less known databases to make sure that we didn't miss pertinent literature. If the literature was written in a language other than English and we were able to get a translation of that article, we also considered that article. If it was only available in another language, we were not able to establish the weight of that literature. Now, this is where I'm going to page through what you have there, which goes over the steps that I've outlined quickly. And I want to come to this graphic that shows the number of articles, almost 6,000 initially searched. 1,300 of those were handled by us by hand, looking at abstracts and titles to determine that they were worthy of being considered for the systematic review, and we screened that down to 659 articles, which we placed into the topical categories, to 12 different topical categories, and then made available to the authors writing in those areas. So the final screen would be the number of articles for that particular topic, and will vary by the topic depending on the depth of the literature. An appropriate weighting or evaluating method was chosen for each topic. One of the examples is that used by the Oncology Nursing Society of the Putting Evidence into Practice, the PEP card. And that was cited as being one of the more accessible ways of evaluating the literature so that the public and clinicians could understand that process. So some of our review teams used that process. Others chose another weighting process that is a very credible way to weight their literature depending on how rigorous their science was in that set. For the PEP card, it's easily understood in terms of a stoplight, the colors of red, yellow, green. So red would mean the evidence would show that that intervention is ineffective or may cause harm. Yellow is caution. There is not yet sufficient evidence to say whether these interventions are effective or not as standalone therapies. And green is go, that evidence supports the consideration of these interventions in practice, certainly in an individualized plan of care for a patient, not to be globally applied, but individually applied. These are the systematic review topics. The topics were initially drawn from the headings in the original best practice document from the United Kingdom. So you'll see here the 12 categories. We expanded what was in the best practice document in that risk reduction was not handled as a full category there. CDT was not handled as a bundled intervention like it's generally used in the United States. Palliative care and policy were two that were not a very large area, and I think I mentioned risk reduction and self-management were not, the literature did not support them to be large categories in the initial best practice document, but we felt the literature or the lack of the literature was very important to bring out in our systematic reviews. So here we have a working picture. Professor Christine Moffett from the ILF flew to be with us a weekend that we worked in Missouri. So you see some of the workers here, Janice and Dr. Stewart, and our assistants helping us with that room full of articles that we were sorting. And these, I want to give credit here to the persons who are dedicating their time to the systematic reviews. I mentioned Mike Burness and Kathy Tuppo are with us. They're focusing on assessment. Electra Paskett's leading the risk reduction. Complete decongestive therapy, Bonnie Lazinski, Catherine Thrift, and DeCourcy Squire led that writing. The surgical approaches was led by Janice Cormier and her team of surgeons at MD Anderson. Exercise by Marilyn Kwan and Joy Cohn. Marilyn Kwan's at Kaiser Permanente, Joy Cohn's at Penn. The IPC, the intermittent pressure devices, was led by Dr. Joe Feldman and Nicole Stout. Other treatments is led by Julia Roderick and Ellen Poige. Complex cases, we have here wound and skin issues. Drs. Carolyn Fife and Wade Farrow are leading that. Palliative care led by Marcia Beck and Asani Wanchai. Living well with lymphedema and self-management, Sheila Reidner and Mei Fu. And they also are doing the psychosocial issues in lymphedema. And then Nicole Stout, Bob Weiss, and Tina Shee, a health economist, are doing economic and health policy issues. They need to really be recognized for the dedication they have to this year-long or year-and-a-half-long process. The office of the ALFP, our staff there, and the editors of Dr. Stewart and Dr. Cormier and myself have supported that team, but the dedication of the first authors is enormous, and these projects couldn't be done without their volunteer effort. Now, I've come to know in working with certain surgeons. The surgeons like to be first and right at the forefront. And it was really important to Dr. Cormier that the surgical systematic review be the first one in the literature. So it was the first one completed, the first one submitted, and the first one published online and in print. And it's a beautiful document. And as Dr. Stewart says, it will always be first. No one can ever take that away. It will always be first. And our goal was to place each systematic review in its best location so that those people that needed to be able to apply that would have that evidence for practice, and then we can disseminate from there. People that are searching for surgical methods for lymphedema will find it, but it's really important that surgeons know that it exists there. So the Annals of Surgical Oncology is its placement, which we feel very, very good about. On your handout, that APA reference will be at the bottom of that square. It's small print, but it's there, and it will also be at the ALFP website if you wish to go there. The second to hit the literature, which was very timely because of the movement and the exercise interventions, was the one by Marilyn Kwan and Joy Cohn that's in Journal of Cancer Survivorship. I'm going to move really quickly then. The IPC, Dr. Feldman led in lymphology, very good placement, palliative care, Journal of Palliative Medicine, self-management of lymphedema is in nursing research, and this one isn't on your handout, but is available in August. And this is physical medicine and rehab, and the CDT review by Bonnie Lazinski and her team. So these are your slides that you have in your set. And so I'm going to go through. What I do want to announce, too, is that in January 2013, a special issue of Seminars in Oncology Nursing will have a summary of all the systematic reviews, and it will be a special issue available with internet access and also as a hard copy. And we're asking permission for each of the reviews to be placed as a PDF at the ALFP website. We have to ask publishers one by one to do that. We can send you a copy by email with individual requests also, but we hope they'll be available at the website. So I think with that I should stop. Thank you, Leslie.
Thank you very much, Jane. And Jane will be around so we can answer any other questions about ALFP. So now I'd like to introduce Dr. Joseph Feldman. He's the co-director of the American Lymphedema Framework Project, and he is also one of the founding board members of the Lymphology Association of America, and is the president. He is a physiatrist certified by the American Board of Physical Medicine and Rehabilitation, and he is the medical director of the North Shore University Health System Lymphedema Treatment Center and clinical assistant professor of physical medicine and rehabilitation at the University of Chicago Pritzker School of Medicine. And Joe is going to talk about LANA. Update us. Thank you.
Is the microphone? Oh, there it is. Okay. Hi there. Enjoy your lunch. It was a really good lunch there. Listen, I didn't make a handout for this informational talk. If anybody wants it, just let me know and I'll be happy to send it to you. LANA, or the Lymphology Association of North America, was a labor of love by many people, some of whom are in this room. Let's see if I can figure out how to get this thing going. There we go. This is motherhood and apple pie, but the organization was to promote standards for the management of individuals with lymphedema and related disorders, to establish and maintain certification for medical professionals who provide such services, and to promote advancement of the science of lymphology. LANA actually began in the late 90s through the good offices of Saskia Theadens, the president of the executive director of the National Lymphedema Network. She recognized there was a need to identify qualified treatment centers and also qualified therapists. That was an era when people would go for a 2-day course and say that they were a lymphedema therapist. Some people, on the other hand, would go for 135 hours or more and say they were a lymphedema therapist. And there had to be some way to distinguish who was who. And this was for the benefit of the patients. We got together, a group of us got together at the National Lymphedema Network meeting in San Francisco at that time. And that was the genesis of LANA. was determined right from the beginning that LANA would be a voluntary certification board. It's not tied to licensure and so on. We couldn't take on the big guys in town like the APTA and the ALTA. So it is a voluntary certification board. In 1998, coincidentally, the American Cancer Society sponsored a workshop on breast cancer treatment-related lymphedema. One of the recommendations is that a multidisciplinary task force be assembled to establish certification guidelines and determine how they should be implemented and enforced in a way that conforms to the current American system, just as the Joint Commission for Healthcare Organizations. So here we see two big organizations kind of coming together with similar idea. LANA then was incorporated as a 501c6 nonprofit organization in 1999. We received a grant from the American Cancer Society, which really was the startup grant. We had no money to start with, and so it was hard to come up with a certification exam without money. And this was through the Longaberger Horizon of Hope campaign, so we certainly are very grateful. We contracted with a reputable organization, Schroeder Measurement Technologies in Florida, and it's a full-service international testing company. And these are the folks that have the expertise to develop a valid, defensible examination. Now, in any certification exam, what you're examining is minimal competency. And you have a field of experts who come together and develop the items or questions on the examination. And SMT certainly gave us the guidance and set up the examination. So we had to do a job analysis, we had to do item writing, item review, test development, standard setting, statistical analysis, scoring, equating, and scaling. This, for any certification exam you ever take, this is the process you have to go through. We also learned that you never have a valid exam if you have answers that say all the above and none of the above. That's not acceptable. LANA subject matter experts meet with the SMT test development staff in 2000 to develop the eligibility criteria and so on. The eligibility criteria became the key here. We determined initially, for the first 2 years of the exam, therapists had to have 80 hours of training in CDT, or comprehensive decongestive therapy, or complex decongestive therapy, however you want to call it. And they also had to have certain basic educational background, which I'll get into. In 2001, we gave the first exam. In 2002, we started electing regional representatives from people in the field, therapists who had been certified. In 2006, we received another grant from the American Cancer Society to redesign our website so that healthcare professionals and patients could locate a LANA certified therapist. And that's currently on our website. If you go to the LANA website, clt-lana.org, you can find by state or name and so on, you can find a LANA certified therapist. I don't want to go through this whole thing, but generally we decided that qualified individuals to take the exam would be physical and occupational therapists, COTAs and PTAs, speech therapists, MDs, DOs, DCs, athletic trainers, RNs, but they all had to have a minimum of 12 credit hours of college-level human anatomy, physiology, and pathology from accredited college and university. The only group that ran into some problem in this is not all massage therapists had that educational background. Some did and some didn't. And we assess each person individually to make sure they meet those criteria. They also have to have 135 classroom hours of complete decongestive therapy. That's a minimum. It could be more than that. And there are the group we call the lymphomaniacs, and these are the ones who take multiple courses. Currently, LANA certified therapists are considered LANA members with access to the only members only section of the website where we have some CME posted on the website. There are over 1,000 LANA certified therapists. We probably have actually certified closer to 1,400, but some for various reasons drop out. They either don't want to renew, or they change professions, or they're not practicing anymore, so you get this usual attrition. We have over 1,000 certified therapists. Over 90% of these therapists are PTs, PT assistants, OTs, and OT assistants. The remainder are physicians, nurses, and massage therapists. And LANA annually publishes a directory of active LANA members. We started doing this a few years ago, and it's been very popular. We've distributed this directory at the American Society of Clinical Oncology meetings in Chicago. We've distributed these directories at the NLN conference, and they've also been distributed at other conferences, and we're working on a project now to get them distributed to the certified breast centers. And so they're available, the directory. We're working now on the 2013 directory. And a therapist locator, as I said, is available on the LANA website, www.ctl-lana.org. LANA, and right now we're undertaking a job analysis. Since we haven't done this for 12 years, we're surveying the field. We sent out questionnaires to every therapist in the field, whether they're LANA certified or not, to find out what they feel is valid content for the examination. On September 5th, some of the LANA board members and some of the directors of the major schools will develop a new certification exam outline. In October, we're going to go over the examination, make sure it conforms to new content outline, update bibliography, and so on. And in January, LANA normally gives an exam, has given an exam twice a year in a three-week block. We're going to start a rolling examination in January. So if a therapist feels they're ready and they meet the criteria, the prerequisites, they can sit for the examination at any time that they can arrange with SMT. This is computer-based testing. We're also going to give the exam at the NLN meeting. We have 5 hardy souls who've signed up for that, and that'll be a paper and pencil test. So for those who like the old-fashioned way of doing things, that was a good way to get to do paper and pencil. That's all I have on LANA. It was just a brief synopsis. Anybody have any questions at all? Okay. www.clt-lana.org.
So I hope that you all understand sort of the magnitude, importance of what Joe just presented. 12 years ago, there was no certification for lymphedema providers. And through Joe and the others on the board, they worked very, very hard and put this exam together. And so now we have people who can treat us who know what they're doing. And it's extremely important to have somebody who knows what they're doing to treat people with lymphedema. And I know we have some LANA certified therapists in the room. If you're a LANA certified therapist, raise your hand. There you go. You got some of your 1,000 here.
Yeah.
As the practice. Wow, that's great.
Well, it's kind of fun at NLN meeting when I'm standing up front doing the introductions and the welcoming and see all these badges saying
LANA.
LANA, 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 LANA.
That's great. I was going to say one other thing, and I forgot. It'll come to me in a minute. All right.